Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert, and I am here today with not only my most amazing and excellent co-host, Dr. Millicent Rovelo. How are you?
I'm doing great. How are you?
I'm doing great. But you are also the subject of this podcast.
I know, I'm the patient.
Wow. It's very different.
It is very different. So, special podcast, we are going to be talking about a surgery that I recently had. You were my surgeon, I was the patient, and we just want to talk about the experience.
And not an easy patient, by the way. No, just
I think we established I was the worst patient.
So doctors as patients could be a whole, like it could be a podcast of its own.
For sure.
I mean, doctors as patients, typically they know better. They want to do it their way, and they typically have problems because of their intense knowledge of the subject matter of what they're going through.
Well, I don't think I did that.
No, you were great.
Think that well, we can talk about my recovery. I just didn't know when to stop doing things, even though I know better. But we'll get to that. So let's just walk through, sort of what we did here.
So the operation that we did so first of all, what caused you to say like, hey, I got to talk to my pal Jay about doing something?
So my concern as I was aging and getting older was that I noticed that my under eyes and the junction between the lower lid and the cheek was becoming very pronounced. There was a groove there, and I constantly had to put under eye concealer on to conceal it. So that was my initial concern, was that lower lid junction there. And then my other concern was my eyebrows. They were starting to descend and sit lower, and it was giving my eyes more of a closed, pinched off look. And if I did too much Botox, I would really notice it because my eyebrows would drop even more. So those were my two main concerns, were sort of that whole upper eye, upper face area.
So you think Botox was hitting its limits?
It was, but the problem was the Botox was wearing off faster and faster because I actually needed to use my forehead muscles to lift my eyebrows. It was a functional thing. And then when I would freeze those muscles with the Botox, then they couldn't do their actual job, which was to lift my eyebrows, and they would sink even lower.
So there you have it. It was all about lower lids and the brow positioning.
Right.
And so the optimal operation for that is really a brow lift and a mid-face lift combined with the lower lid blepharoplasty.
Correct.
And what that is, and that's very fancy terms for lifting of the cheek, which is a mid-face lift. We call this mid-face because the typical facelift is when we make cuts around the ears and we lift the skin and the thick tissue over the muscles. This is really about a cheek lift, a lateral brow or a temporal lift where we're lifting the tail of the brow and the temporal skin. And then by going through the lower eyelid and releasing the junction of the lid, you can blend the lid cheek junction and not need as much concealer.
I haven't used any concealer since the procedure, which is so exciting because I'm also a bad driver. I will do my makeup when I'm driving on occasion. And so I'm looking.
Confessions of a Beverly Hills plastic surgeon
on my way to work. And so
you're not the only one, by the way.
Bright daylight, I'm looking in my car, at myself in natural light in my rearview mirror or in my little vanity mirror in the car. And that's when I would really notice the pronounced, not even circles, but just volume loss between the lower lid and the cheek. And there's a ligament there. It has a name, the orbitororetaining ligament. And so that ligament is what really was pronounced. And I needed to have it released so that you could then lift my cheek up. See, I'm telling you your job.
You know my job. I thought the interesting thing was when you were thinking about doing this, you came into the OR and watched me do one.
I did,
which
yes.
would have, for me, been like, okay, I'm definitely not doing that. And you were like, okay, I'm ready.
Okay, I'm next. Sign me up. My turn.
Yeah, I mean, it does work. I mean, it's a very effective operation. And, the thing that people see with it is... Why don't we wait for the sirens to complete?
To pass on Santa Monica Boulevard.
Jeez, it's like unbelievable.
Every time.
You know what's funny about that too? Like the fact that we're sitting here waiting for sirens to go by. Sean will actually leave this portion in the podcast. And he'll say something like, yeah, I just thought it was funny that you guys had to wait for sirens. It's like, wait, there's my ride, So I think that the interesting thing about the operation is that not only does it help to smooth that lid cheek junction and get rid of the tear trough deformity, but I think it makes your cheek look better than it ever has looked. I think the change of positioning is not something that, it's not like we restored it. It's actually like a more heart-shaped face that really looks good. I mean, I notice on you when you walk in, you look different. Like when you come in, I'm operating, you like poke in, hey, what's up? You can see that your face is a different shape than it was before we did this. I don't know if it's the shape that you were when you were 22 or 25 or whatever, but it's really nice because you have that really great OG curve, as they call it, where it's kind of, it curves out and then curves in, and it's a very good-looking, attractive shape of your face.
Right. And that was the goal. And that's what we typically try to accomplish with fillers. So if you go to see someone for fillers because you're worried about, the aging face, one of the first things that they're going to do is suggest that you have fillers on your cheekbones because it restores that more pronounced youthful cheek look. A lot of times people also use under eye fillers to also camouflage that lid cheek junction and hollowing that you get between the two. As much as I like fillers and I use them on myself, I put them in patients, I don't actually like them that much on myself if I know that there's a surgical solution. Even on my patients, I would rather give them a surgical solution when I know that one is available, because fillers, they only camouflage. They don't actually treat what the underlying pathology is.
Right. This is a composite. It's moving everything from the skin down to the coating over the bones, the periosteum, moving it as a composite and repositioning the whole, side of your face, which I think really, it looks really nice for people. I've done like 6 of these in the last 3 weeks,
which we have now renamed them the Millicent.
The Millicent. like, oh, you're doing the Millicent.
and it's that exact combination. So let's talk about how the whole process worked. For me, I came the morning of surgery. I went to surgery. Took how long?
I think it was about 2.5 hours.
2.5 hours. I also had a laser procedure done at the same time while I was asleep. Orla, our fabulous PA, came in and blasted my face with a laser because... Did
she do Opus or was it the Pixel?
She did IPL and Pixel combination.
So the Photo Pixel.
So that's a good one really to do designed
under anesthesia.
Under anesthesia, because she could really turn up the settings.
Oh yeah.
Which, if you're awake, is a little bit harder to tolerate, and it's doable. But she was really able to go to town with the laser because I was asleep, and so that addresses pigment, brown pigment, and also just overall tone and texture of the skin.
Right.
So I sort of had a big combo procedure done.
Right. And then you did recovery at a nearby hotel with one of your pals taking care of you.
Yes.
So that you were, in case anything should happen, you had somebody with you.
Yes.
But then you were also close by to the surgery center, which was nice.
Yeah.
And then you went back to work the next day, which I thought was really inappropriate. So
I did. I had to do. It was a really small. It wasn't the next day. It was 2 days later.
Whatever.
I had a really small, tiny case. I had to do it. I had a PA helping me, so she was able to do like a lot of the heavy lifting of the case, and I sort of. Anyways, I know. It had to be done. I do not advise doing that. And then
this is a do as I say, not as I do.
And I was driving myself, and
beautiful.
After all of that, you yelled at me and said, "Stop! You're going to affect the final outcome." You appealed to my vanity, which was the trick, and I stopped.
Yeah, I mean, you were going to go full bore.
I know, and I had cases scheduled for the following Monday, which was like 5 days later, and you told me I had to cancel those, so I did.
No.
But that was the hardest part, is I actually felt fine. So from my standpoint, what I felt, there was some pain that night. I tried taking a pain pill. It didn't work. I was nauseated. So I just took some anti-inflammatories, and that was more than enough.
Celebrex is great for that.
After that night, I didn't take any pain medicine. What was most disturbing was how swollen I was. That I was not expecting.
But that's because of the laser.
The laser.
When
combined
you combine the laser with facial aesthetic surgery, Pumpkinhead is
Oh my
it's the
gosh.
best Halloween costume you can
I
do.
was a pumpkin. The people that saw me were like, "Ay, that's gonna come down, right?"
No, this is what I was shooting
This
for.
is what I wanted.
You did. You looked like the Stay Puft Marshmallow Man. It was pretty terrible.
It was pretty bad. So the things I did for my recovery, I went to hyperbarics immediately the next morning, and I did several days worth of hyperbarics. Hyperbarics is a treatment where they put you kind of like an MRI machine. It's this tube structure that they send you in, and you sit there for an hour, you watch some Netflix, and you're breathing in 100% oxygen. And the idea is that really helps in the healing process. It helps with the swelling, it helps with the recovery.
Right. It does a couple of things. It delivers higher oxygen tension to the wounds,
Yes.
so they heal faster, but it also brings the swelling down a ton.
Yeah.
Like it takes months, I think, off of your recovery.
Yeah. Well, we also did a Medrol dose pack, which I think helped too.
Yeah, that does help a lot too.
Yeah.
But you were back at work legit like the following Tuesday. Like
Yeah.
It was 7 days after
One
surgery.
week later, I was seeing patients all day in the office, and I was operating the next day or the day after that.
Yeah, and you were fine at that point. But,
Yeah.
you know, the initial week, you kind of give it some time to kind of like settle. Especially, I don't want it to fall down. Like, you know,
Right.
we wanted this thing to really, sit where it's at. And you need to stick down. But, once the periosteum sticks, that's over. It's a done deal. So after 5, 6, 7 days, it's where it's going to be.
Right. But yeah, the hardest part was just staying on my couch for 2-3 days and not doing anything. Like I felt like I was wasting time. Like I have all this time. I should be doing something. I should be on my computer. But like you can't.
No, and you can't do it if you're on drugs too.
And you can't. Well, yeah, I know you can't do it on drugs. That's not optimal. But just
I
stopping.
tell all my patients that. I go, look, you're going to be home and you're going to be on drugs and you're going to think, man, I have all this time. Time to send some emails.
No,
This is not the time to send emails.
it's not. Just
You may lose
no.
friends. You may,
You may lose your job.
poorly influence others. And we had a big actor fire their agent in the recovery room. And I was like, what are you doing? I was like, who gave her cell phone? And I was like, what did you just do? She goes, I fired my agent. I've wanted to do that for so long. I was like, get him back on the phone. You tell him you're in the recovery room. I said, I'm not going to be responsible for that. She was like, I'm drunk dialing. I was like, you are drunk dialing. You cannot do work while you're on drugs.
Although maybe she made the right decision. Maybe she wanted to do it for a while and just didn't have the guts. And under anesthesia, she was like,
She did ultimately fire her.
"You're fired."
That did become permanent because she really wanted to do it. And evidently having some anesthesia on board
Little
kind
truth
of
serum.
gave her a little bit of the oomph she needed to get that one over the line.
Yes, agreed.
Well, yeah, so that's it. But you were back and doing your stuff. And I think you looked really good after about 2 to 3 weeks. It really settled.
Yeah.
I thought you looked a little surgical for the first 2 weeks, which is to
Yeah.
be expected.
Yeah, my eyebrows were sitting a lot higher initially, and obviously the swelling. My eyes were bruised. The actual eyeballs were red for almost 2 weeks. That took a long time to go away. And I didn't really start feeling comfortable wearing contacts for a good 6 weeks. I wore glasses for a while.
Yeah, that's the conjunctival incisions are a little bit swollen on the inside of the eyelid, so you need that to kind of settle.
Yeah. But no, overall, I would highly recommend it. You know, honestly, outside of you were the only person in support of this procedure, because everyone else, I mean, most of the people that I'm friends with are not in the plastic surgery world. We're like, I don't understand what you're doing. You're getting a facelift, like you're 38. What is wrong with you? No one really knew what I was doing or why I was doing it. But I knew, because I look at my face and I look at the signs of aging and I could see what was happening and I knew what I needed. But those same people, after I had the surgery, were like, oh, wow. Okay, I see it now. Like, you look great. And,
Yes.
And they didn't get it before, but then afterwards they were like, oh, okay. They couldn't pinpoint what was different per se. They just knew it was better.
Right. You can't, like, you look awesome, but you can't be like, oh, this is what's different.
Right.
I can because I did it
Right.
and I know what happened, and you can because it's your face. But anybody else just sees you as just like, oh my God, did you go away on vacation? Or like, you look amazing.
You look more refreshed. And so this is
Right.
this is the age group really that benefits. It's that late 30s to early 40s age group that doesn't need a facelift. You know, a facelift really addresses the lower face and the jawline. And that's not what this age group needs, because what you typically see as the first sign of aging is this upper mid-face area. But I feel like a lot of people just don't know about it because it's not an operation that the general public knows about. Everyone knows a facelift. They might know a brow lift, but a mid-face lift, most people go, huh? What's that?
Yeah, it's true. I mean, there are guys that, really push this as their part of their like general facelift. But I like to do this for like you said, age, I mean, I've done this as early as 28 years old. If people have the descent, or they just want to change the shape of their face. It's not because they've necessarily aged. It's that they just will look better with that, fox eye thing that everybody's talking about now. And I've been doing this operation since like 1998, basically, is when I kind of got into this, when I saw the guys from Atlanta, actually, Rod Hester and the whole group at Pace's Plastic Surgery, which I don't even know that they were Pace's then, Mark Codner and those guys, they were doing this operation. And I was like, oh, I really like that. And I started doing it literally at McGee Women's Hospital when I was a resident. And I've kind of gotten it down where now I can really make things move with it. It's awesome. I love doing this operation.
Well, I thank you.
Yeah, well, it looks good on you. You wear it well.
Thank you.
Yeah, I mean, I did think it was funny, though, that after you watched me do it, you were like, okay, I'm good. Because it's a pretty invasive operation from a, just like to move the cheek is not nothing. Yeah, you really have to. You're
taking apart the whole face and then lifting it up.
Yeah, I mean, it's like a real operation. It's not like, I'm just going to, which, these, I don't even want to talk about like the threads. Like, this is not the threads.
This is not a thread lift.
No, the thread lift it is going to last, I don't know, 6 months, a year. I don't even know what the data is, but they probably don't have any because it's probably so disappointing. Right. They probably don't even want to like show the data. But the difference is with the thread lift is it's going to cheese wire through the soft tissues, and whatever you pull up is going to come back down because you haven't moved the underlying structure. Right. This operation moves the underlying structure and you're finished. It's also, it's a little bit more recovery. It's obviously more expensive, but the, we did do the family discount for you, which is part of the deal when you're in the fold. But it's still not cheap.
It's not cheap. That's for sure. No. Yeah, it's a real operation, a real procedure. No matter who you go to.
For sure. I mean, I think it's worth it because I've not seen a mid-face descend after doing this.
Awesome.
Yeah, I just haven't. Now, this part that. Down here, we'll get to that at some point, but that's years
like
off for you.
Another 5-6 years.
Yeah, you got 5 years or so. You're good on that one. But if you jump on these things earlier, then you can continue. The whole point is to look great the whole time.
Right.
Like some people are like, oh, I'm going to wait till I'm 72 to get that done. I was like, well, then just don't do it. Like you're already, going to be, 15 years too late to your facelift.
Right.
And you don't want to be that. You don't want to be 15 years too late to your facelift.
Because your
you want
result
to
is
get done.
Just not going to be as good.
No, and you missed all that time that you could have been looking awesome.
Face, yeah.
Yeah. So it's like, now you look old and then you have a facelift and it's like, well, you look less old. Is that good? I don't know. But you can stave off the aging and keep looking great all through your 40s, 50s, 60s, into your 70s if you're doing things along the way. That's the key.
Yes.
Cool. Anything else you want to talk about? How about the incisions? They've healed pretty well.
Oh, yeah. Well, the incisions are completely hidden. So I have 2 incisions in my hairline, off to the side here, 1 on each side. And then in the inside of my lower lid
right,
here.
So there's no visible
so you don't
cuts.
Even see them, no.
Yeah, so I could come up with some stupid-ass marketing campaign like invisible incisions, which I can't stand when people do that, so I'm not going to do that. Because there are incisions. And for those of you that do marketing campaigns like this that are listening to that, no offense to your stupid-ass marketing campaigns. But, I mean, I don't like when people say, like, oh, scarless this or invisible that.
I know.
No, it's not true. There are scars. Anytime you cut skin, there's a scar. So you do have scars. They're just very well hidden. You don't see them.
They're invisible.
Really? Maybe you should do the marketing campaign. I had invisible incisions with my mid-face lift. No, I mean, there are scars. I mean, there are cuts. There have been problems with visible scars in the hair if the hair doesn't survive there. So I have a very special way that I close them and have it, heal up. But if the hair doesn't survive along the incision, it's visible.
Right.
And you have to revise that. And you have to, sometimes I tell people it's better to get hair grafts put in than to try and revise it, because the scar is too thin or whatever. It's going to be a problem. That's infrequent.
Very infrequent.
I've seen it from I just literally came from a mid-facelift, a revision mid-facelift and brow lift from a patient who had it done in another city, and the scars were awful. And so I had to redo it, and I used these terrible incisions to do the mid-facelift and brow, and hopefully she'll heal it up better. And I think the problem was, when I got in there, they hadn't released the periosteum. So they were trying to do the brow lift without releasing the periosteum, so it stretched the scars.
There's so much tension too.
Yeah, so of course it's not going to work. Yeah. So they stretched the scars out, and that's why that didn't work. So I released the periosteum, obviously, and so when I closed it was a tension-free closure. But I feel bad about the stupid-ass marketing campaign comment. Was that mean?
No, and I was laughing because I was in the OR the other day, and one of the scrub techs was asking me, she's like, "Doctor, I saw on Instagram this doctor that does scarless mastopexies and augmentations."
Oh, my God.
I was like,
I can't
there's
take it.
literally no way that you can do it. No, he says he does it without scars. Okay. If you're putting an incision on a patient, you're going to have a scar. Maybe he hides them, like in the areola or something.
But that's false advertising.
She was going to sign up because he does
she's going to have a mastopexy
surgery
without a scar. I mean, it's just wrong. Like, that is not true. Scarless rhinoplasty. Like, what is that? You mean you don't have so it's an endonasal.
It's a closed
That's
rhinoplasty.
Right. There are still scars. You can still have problems. They happen to be inside the nose, but those are scars. And those scars come complete with all the problems of other scars.
Right.
You can get vestibular stenosis. You can get problems with it. You can get, synechia. You can get banding. There's all kinds of problems that happen even though you can't see the scars. It's not scarless. There are scars. I'm sorry. I'm going to call it out. I can't stand it. It is such BS marketing, and it's so designed to, like, I don't know. I think you should be transparent with the public and tell them what's so.
Which is why we do this podcast.
That's right. So there you have it. If you want a scarless brow lift, come to me, and I'll hide those scars, and you won't even see them. I mean, come on. I can't stand that. That's just me.
No, but seriously, if you want a mid facelift, this is the guy. He does a great job.
I want a mid facelift. Are you going to do mine?
I'll do yours.
All right, because I need more than a mid.
I know.
Need like a total.
I wasn't going to say anything.
It's awful. I need like a total overhaul. I need help badly. I need a neck lift and a facelift. You know what I should do? Somebody should put me out to pasture. It's over. It's time.
You still got
I'm
some
52
time.
and I've hit it.
I need you to be around to do my facelift. So.
All right. So I'll do another. Yeah. I'll do 5 more years.
Thank you. Appreciate that.
Very good. Well, in that case, I appreciate you sharing your story with everybody, Dr. Rovelo. It's, I'm sure, an eye-opener for everybody. And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.